Okay, good morning. We are going to go ahead and get started. Welcome everyone to the 10th meeting of the Health Services Committee. And I see that we have a quorum, it looks like. So DJ, please take the roll.
Representative Bentley. Here. Representative Bratcher. Representative Bray.
Present.
Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Duval. Representative Frazier Gordon.
Yes.
Representative Justice.
Here.
Representative Neighbors.
Here.
Representative Rayburn.
Here.
Representative Raymer.
Here.
Representative Riley. Representative Rorks.
Here.
Representative Sharp.
Present.
Representative Wilner.
Here.
Representative Whidden. Here. Vice Chair Dotson.
Here.
Chair Mosier.
I'm here. We have a quorum established to do business, and we will go ahead and get started. I will call Senate Bill 297. I think, yes, Senator Storm is here, and if you have any guests, I see folks approaching the table. Please introduce yourselves for the record, and the floor is yours.
Thank you, Madam Chair. Brandon Storm, Senator of the 21st District.
Good morning. Bob McFalls, and with Senior Community Care of Northern Kentucky PACE program.
And David Cook with Hospice Health and Care Guide Partners PACE.
Thank you for being here. The floor is yours.
Thank you, Madam Chair. Members of the committee, Senate Bill 297 is called the PACE bill. It's a very simple bill. Basically, PACE stands for Program of All-Inclusive Care for the Elderly. And Senate Bill 297 does two things. Number one, it establishes that additional licenses are not needed, which reduce the burden on PACEs as well as the cabinet. Number two, Senate Bill 297 enables PACE programs to access the care system to run background checks on staff to ensure patient safety. That's what the bill does. Basically, PACE is a more cost-effective option that allows these individuals to live in their home community rather than a nursing home. Most of the participants are Medicaid and or Medicare eligible, and there's an interdisciplinary team of professionals that care for these individuals. So in the event my guests would like to say anything further.
Motion on the bill.
We have a motion and a second on the bill. Are there any questions or any discussion? Okay, seeing none, DJ, please take the roll.
Representative Bentley. Yes. Representative Bratcher. Yes. Representative Bray.
Aye.
Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval. Representative Frazier Gordon. Yes. Representative Justice.
Yes.
Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Representative Rorks.
Yes.
Representative Sharp.
Aye.
Representative Wilner.
Yes.
Representative Whidden.
Yes.
Chair Mosier.
Yes. Okay. Senate Bill 297 passes with favorable expression unanimously. Unfortunately, we do not have consent here. Otherwise, I would make that motion. But congratulations. Thank you for this work. This is important. Thank you. All right. Next, we will hear House Bill 204. I invite the bill sponsor and your guests to come to the table, introduce yourself for the record, and go ahead and proceed.
Thank you, Madam Chair, for this opportunity to present today. I am Representative Marion Proctor. I represent the 60th District.
Jamie Kavanaugh, I'm Jamie Kavanaugh. Good morning. Legal Policy Counsel with the Pacific Legal Foundation.
Hi, I'm Heather Lemire. I'm the State Director for Americans for Prosperity, Kentucky.
Okay, I'm going to allow 15 minutes for each side, and then we'll try to roll the questions into that. So just to give you a heads up.
Thank you. Well, briefly, I would like to explain a little bit about Certificate of Need for those of you who may not be familiar with it. It is basically a government permission slip that requires a new health entity that is wanting to enter the state to go through a pretty stringent process through the cabinet. It's a 9-step process to get approval. You have to meet the formula, you have to demonstrate the need, and then you go through that process. What my bill is looking to do is to eliminate a dominant provider's ability from suing somebody out. So in Kentucky, we have over 32 services and technologies that are regulated by certificate of need. And that's hospitals, ambulatory surgical centers, emergency room departments, ambulances, adult daycare, home health agencies, hospice. There are a myriad of services, imaging, MRI, PET scans, things like that. So what we are wanting to do is to make it so if somebody is wanting to invest in the state of Kentucky, that they are able to do so. This bill does not change any of the process of certificate of need. You still must demonstrate that there is a need, and you still must go through this 9-step process. What this bill does is just eliminates the dominant provider's ability to sue you at step 3 and step 9. So letting the cabinet to make that decision, not our circuit courts. So I will have Jamie Kavanaugh, our legal expert, explain more of the bill.
Thank you, Representative Proctor, Chair Moser, members of the committee. This is a very straightforward bill. It's a procedural change, as Rep. Proctor just mentioned. It's not changing any of the criteria required to get a certificate of need. It's not changing the cabinet's ability to review applications and make its own independent determination on each application. This minor procedural change would actually be in line with what already happens in Indiana, Louisiana, Michigan.
Motion on the bill.
We have a motion on the bill. Who did that come from? I'm sorry. Okay, Felicia. Okay. We have a second. Okay, so we have a motion and a second. I believe we have some other testimony which I'd like to allow, and then I would like to allow time for questions. So is there anything else that you would like to add?
Yes. So the list includes Nebraska, New Jersey, New York, states that all have certificate of need laws in place, but don't allow an incumbent provider to stop a granted certificate of need from moving forward. This isn't a full repeal bill, as we've seen in many states around the country, in South Carolina last year, or as is supported by ALEC. ALEC has had a resolution in place since 2009 supporting full repeal of certificate of need. And this is a very early interim step. And I'll just address one other concern very quickly, which is what I hear usually about the concern for rural facilities. And luckily, since 40% of the population of the nation live in states that don't have certificate of need laws, we can easily compare what happens when states repeal their certificate of need laws. These states all had them at one time and have since repealed them. And we actually find that there are more rural health cares, more rural hospitals per capita, and more rural surgery centers per capita in states that have already eliminated certificate of need. So that shows that these facilities are able to open and stay open, discounting this argument that a surgery center will take the profitable patients away from a hospital and close the existing facilities. We've also found that safety net hospitals have higher margins in states without certificate of need laws, so further bolstering their ability to stay open and provide care for the community. So with that, I'm happy to answer any questions.
Okay, thank you. Representative Whitten.
Thank you. I just wanted to clarify, so this bill in no way repeals certificate of need, correct?
Correct. It does not repeal certificate of need.
Okay. All right, so we have some folks who have signed up to speak. Heather, I see that you're on this list. Did you want to weigh in at all?
I have a written statement, but I really just wanted to add that yesterday I spent the day with the owner and founder of Trinity Healthcare in Corbin, Kentucky. And I just feel like she had such a compelling story that could really speak to this bill. This healthcare facility is growing by leaps and bounds because of the needs for that area of the state. And right now they provide a number of services, but they are seeking to have a freestanding birth center. She mentioned that in 14 counties that there are only 24 beds as far as women who are in childbirth. And this was alarming to me. And so she said there is just a huge need. There's also a lot of women who are being, I guess, pushed into having C-sections, and a lot of women obviously do not want that choice. So she is going through the certificate of need process, beginning it, and she doesn't know if this is going to cost anywhere from $10,000 to $100,000. And she is just one provider who saw a need and is really trying to make a difference in Eastern Kentucky. And her biggest fear, though, is that the hospital system there is going to try to stop this process, and that she will have to deal with that legal issue in addition to what she's spending on the certificate of need process. So obviously this is a very flawed system, and again, this does not address repealing certificate of need, but this would at least make it a fair playing ground for people who are wanting to go through the process. And I think her story just really illustrates that, because she has a fear that she's going to have to deal with the legal issues and ramifications of the hospital system basically trying to stop her from going through with this process.
Thank you. And we're having that conversation separately from this. This bill doesn't really deal with freestanding birthing centers.
Right.
And so we are having that conversation separately. It's in non-sub, so it's a really streamlined system of approval. So different topic and different conversation, but I appreciate your comments. We're going to allow some folks who have signed up to speak, and I guess I can have Heidi Schlisser-Lanham come up to the table first, if you would like, and you all just stay close if we have questions you might be needed.
Good morning,
Good
everyone. Thank you.
Is your microphone on?
I thought so. It's lit.
Okay.
Is that working? Can y'all
That's
hear me?
better.
Okay.
Thank you.
Thank you for having me, chairs and the rest of the committee. I'm Heidi Schistler-Lanham. I am the legal director at Kentucky Protection and Advocacy. We are an independent state agency that advocates for the rights of persons with disabilities throughout the Commonwealth. Not only are we a small advocacy organization, but we are also advised by two advisory boards, one made up of persons with intellectual and developmental disabilities and their families, and the other advisory board made up with persons with mental illness and their families and sometimes their caregivers. This bill would take away the right and the voice of persons with disabilities in the process of the CON. Currently, anyone who is what's considered an affected party can ask for a hearing, and affected parties include any person who regularly uses facilities within the geographical area. Over the last 20 years, on at least 7 times, we have represented persons with disabilities or their parents in trying to let our formal ideas about the process and about this facilities be known. These have been regarding ICF's IID or for persons, institutions for persons with intellectual and developmental disabilities, and then in the children with severe emotional disability field, hospitals, PRTFs, psychiatric residential treatment facilities. We have represented and involved ourselves in the CON process as affected parties. If this bill passes, that voice would be taken away. You would not be able to hear what persons with disabilities throughout the state feel about certain facilities and health care. In addition, last interim, there was a task force on the CON, which lasted throughout the interim, and one of the takeaways from that task force specifically said that further study may provide additional information to guide statutory and regulatory changes in Kentucky's Certificate of Need program. The task force basically found that there are currently competing ideas about the necessity and efficacy of this whole CON process. So at the end, they said we probably need further study. And in fact, Senate Concurrent Resolution 42 would reestablish that task force, and it actually says that one of its tasks would be to consider structural reforms to the CON program, including application, approval, and appeal processes for obtaining a CON. This is premature to do this at this point. We need to be looking at those kind of things. We're not here on behalf of major dominant providers. We're here on behalf of persons with disabilities whose voice needs to have a voice in this process. Thank you. I'm happy to answer any questions.
Thank you so much for your testimony. I'm going to ask you to just stay put. I'll
Sure.
invite Mark Guilfoyle, Nancy Galvani, and Don Floyd to just come up and join you. That way we can have this conversation together, and if there are questions, we can just streamline the process a little bit. Just introduce yourselves for the record and go ahead with your testimony. Thank you.
Good morning, Madam Chair and members of the committee. I'm Nancy Galvani. I'm the president of Kentucky Hospital Association, and thank you for having me here today. I'm here to speak in opposition to House Bill 204. Through very subtle changes to 6 separate statutes, House Bill 204 effectively nullifies Kentucky's Certificate of Need program. And I wish to be very clear about this. House Bill 204 does not reform Certificate of Need. House Bill 204 does not improve Certificate of Need. House Bill 204 effectively abolishes Kentucky's Certificate of Need program. House Bill 204 allows only a Certificate of Need applicant to request a public hearing on a Certificate of Need application. House Bill 204 allows only a Certificate of Need applicant to submit information in support of a Certificate of Need application. House Bill 204 requires the Cabinet to issue a Certificate of Need even if a Certificate of Need decision is appealed. House Bill 204 denies communities notice that a Certificate of Need application has been filed. In short, House Bill 204 makes the Certificate of Need process just another licensing process. Communities that are affected by a Certificate of Need application will be denied any process to question or challenge a Certificate of Need application. The Cabinet will be required to approve all Certificate of Need applications because House Bill 204 would deny the Cabinet from receiving and considering any comparative information to evaluate whether a service or facility is needed. The KHA and Kentucky's legislative leaders have worked cooperatively over the last year to examine the Certificate of Need program. The KHA was an active participant in the legislative task force that was organized to examine ideas that promote thoughtful and meaningful reform. And I might add, the Kentucky Hospital Association presented recommendations for modernizing the Certificate of Need program. That task force agreed that further study was needed before any material changes to Kentucky's Certificate of Need program would be considered. House Bill 204 sidesteps the task force's recommendations, and it seeks to undo Kentucky's Certificate of Need program entirely. KHA's member hospitals unanimously oppose House Bill 204, and we encourage each of you to vote no on this bill. I'd like to turn it over to Don Lloyd.
Thank you, Madam Chair, members of the committee. I'm Don Lloyd. I'm the President and Chief Executive Officer for St. Clair Healthcare in Moorhead, Kentucky. We are a regional referral center. We're certainly not a dominant provider. We are not members of a large national or for that matter, international health system. We serve as a safety net provider and have for the last 60 years. 81% of the patients we serve in an 11-county region are either infirmed, low income, or elderly. 81% of the beneficiaries that we serve are either Medicare or Medicaid beneficiaries. 19% of our total operating income comes from other sources of income, including commercial insurance and the provision of indigent care. We are subject to the current rules and regulations of the state of Kentucky as it relates to certificate of need. We are one of those providers that is not dominant, that would lose their ability to argue for the quality and safety and need for a particular clinical services for the region that we serve, which is and has been since 1960, according to the Appalachian Regional Commission, an impoverished region. If you overlay the current map of ARC as it relates to poverty by county in the communities we serve, there has only been one county who has moved from a bright red to a lighter shade of red. We are an extremely challenged and impoverished region that where our health system in our service is trying to provide services beyond just the provision of clinical care. We have tremendous social determinants of care, transportation being one of those. In our clinics in Elliott County, Kentucky, we have individuals that live on the border of Magoffin County, or even in Isonville, a small community just a few miles from Sandy Hook, Kentucky, who struggle with transportation needs just to get to their primary care physician. And our health system has to find mechanisms working with local communities to meet those needs and fill those gaps. While none of us like regulation, we're in one of the most heavily regulated industries in the country. There are no less than 26 federal agencies that my small rural health system must answer to at some capacity, not to mention the state regulatory obligations and requirements that we have. Those regulations, while we may proclaim them to be burdensome, are for the benefit of patients and their safety, and to meet their clinical needs. The ability of the communities we serve or our institution to question the legal merits of an entity that would like to come to our community is, in our mind, it is just absolutely unacceptable. And so for the safety and for the provision of quality care, please do not diminish the ability of the state or the communities that you serve to question the quality and needs of services under the existing regulation. I thank you for your time and the opportunity to speak.
Foyle. I am a CON lawyer from Northern Kentucky, and I represent St. Elizabeth Healthcare. And over many years, I've represented both applicants for a CON and people who have opposed them, including nonprofits in the community. And what we would like to do today is to explain precisely how House Bill 204 effectively repeals CON in Kentucky. And on page 5 of the bill, if you look at section 3, you can see in real live language what Ms. Schitzler-Lanham described, and that is the deletion of the term affected person. So on lines 5 through 7, the bill says from now on, only an applicant for a CON may request a public hearing, and it deletes the right of any affected person to request a hearing. So first of all, one requests a hearing in the Certificate of Need world in order to oppose a CON application. Well, what applicant for a CON would request a hearing to oppose its own application? It's not going to happen. And the key is that the term affected persons is defined in 216B.015, not in this bill. And that definition stays in the law because this bill doesn't do anything to get rid of it. But it does, as Ms. Schitzler-Lanham said, it relates to anyone who utilizes health facilities in the geographic area that is supposed to be served by the application. And even more broadly, it relates to any person in the community. So this is what Mr. Lloyd is talking about and Mrs. Galvani is talking about. The community, under current law, the community has the ability, not necessarily to fight or oppose, but to come to a hearing and present comparative evidence on whether something should or should not be granted. That includes people with disabilities. That might include a nonprofit dialysis provider that I represented in a case. So this bill takes away those rights. And so it effectively repeals CON because by saying only the applicant can request a hearing, that's never going to happen. There's never going to be any opposition to a CON application if this bill passes. And so that's going to mean if I want to get a CON, I just file the paperwork and I wait to get my approval. That's what Mrs. Galvani meant by this is just going to be a licensure process. And that's not what we want to have. So we believe that this particular bill really makes a mockery of the CON process. It is not a, quote, minor procedural change, as you heard earlier, but it also makes a mockery of the legislative process. And I say that because my client, myself included, we participated on August 21 of last year in front of the task force. We came forward. We made it very clear that we're against repeal, but we also made it very clear that we're in favor of modernization. And in fact, in 2018, we supported House Bill 444, which added a number of exemptions to the CON law. So that needs to be constantly evaluated by pros, people at the cabinet, and people in the industry. From time to time, certain things should come out of the CON regulation, no question about it, and we've supported that. In 2022, we supported House Bill 777, which removed the certificate of need requirement for ambulances in many instances. We're in favor of these things. And that's what we told the task force. As Mrs. Galvani said, I think Ms. Schitzler-Lanham as well, the bottom line of the task force is let's keep looking at it, let's keep studying it. Let's not repeal it right now. But let's think about what we can do to streamline the process and make it more modern. We're in favor of that. We're opposed to House Bill 204. Thank you.
Thank you so much. I appreciate your comments. And certainly about the task force, I was watching the proceedings of the task force this summer and appreciated all of the dialogue because this is a really complex system. And it's difficult to take one piece and not have it affect everything else right now. And so that's what gives me pause right now. So I think we have a few members who want to further discuss this, and you all can stay put. We'll see if the questions are directed to you or to the bill sponsor and act accordingly. Okay. Representative Bray.
Yeah, I've got a couple questions and some comments for the bill sponsor, please.
I don't know if we can just pull chairs up and scoot around. I don't know how this is going to work. Thank you.
So we've heard a lot about the task force. What were the recommendations from the task force?
To have another task force.
Okay. And then do you all know, like, within healthcare, particularly rural healthcare, because that's what I really care about, which services are profitable and which ones aren't?
Well, we have a pretty good idea, but I'm going to defer to my expert on that.
It depends what services each rural facility operates. There's new federal regulations that restrict the ability of rural healthcare facilities to offer certain services if they want to receive certain types of federal reimbursement. So, it can depend, but the certificate of need process also holds rural hospitals back from adding on services, updating equipment, stuff like that.
And if I can say to you as well, the certificate of need is being conflated with reimbursement. All a certificate of need is, it's the process to go through to be able to open. It has nothing to do with reimbursements.
Yeah. No, and I agree with that. But over the interim, I chaired a task force myself. We generally assign very complex issues to task force so that we can study them, so that we can bring everybody in, and we can kind of learn about them and then figure out where to go from them. The jail task force, we had a recommendation to have another task force. Guess why? Because it's an extremely complex issue with no great, easy solutions. And what really concerns me about this, while I support the idea of free market, and at its core, the idea of a free market within healthcare, that sounds great, but the bottom line is, in my part of the state, in rural Kentucky, we don't have free market healthcare. We're heavily dependent on Medicaid reimbursement rates, which is kind of what you had talked about earlier. We lose money, a lot of money, operating emergency rooms, operating cancer treatments, operating dialysis. These services that we provide to people in times of emergency, we lose money on. And the things that are profitable that the hospitals offer to where they can make a little bit of money to break even, I have a big concern that we're going to have people come in and cherry pick those services off and not provide the emergency medicine, not provide the cancer treatment, not provide the dialysis, because rural hospitals are struggling. Representative Bentley's had one close. Representative Sharp's had one be acquired because they were getting ready to go under. Things aren't great in rural Kentucky as far as health care goes because we haven't adjusted our Medicaid rates. We're too Medicaid dependent, we're too Medicare dependent, and we don't have enough private insurance. It terrifies me that my hospital back home would have to look at reducing services they offer in order to be accommodated by another group coming in and cherry-picking services. And while in northern Kentucky you all have the population that could possibly sustain that, in rural Kentucky we don't. And it's just, I think this, while I do agree CON, it's burdensome, it's extremely cost prohibitive, I do think there are things that we can do to modernize that, but it really needs to be studied. We can't just repeal the ability of a provider to protest something that's going to negatively impact their business, because the fact of the matter is, in rural Kentucky, our health outcomes aren't great. We know we're too obese. We know we have too high of smoking rate. We have higher instances of cardiac health. We have higher cancer rates. And it's my fear that by repealing something that we've not thoroughly studied, it's going to have a major impact on providers in rural Kentucky. And truth be told, there's a couple bills filed in the Senate right now that deal with reimbursement rates through HRIP. And the fact that those are even filed shows that there's a need to talk about reimbursement within rural healthcare. And as hospitals are being acquired by larger hospitals, we're going down the path of the single payer provider and single payer health system. And as Medicaid's expanded, as Medicare's expanded, I mean, that's just the direction we're going. And it worries me that this is another step to speed that process up. Thank you. Thank you all.
Thank you, Representative Bray. Representative Burke?
Thank you, Madam Chair. My question is actually for the opponents, if you all would mind coming back to the table. I want to thank you for your participation in the task force over the summer. I was so honored to participate in that because, like many people, I had no idea the absolute complexity that it takes to create healthcare under our current regulatory bodies. What I've learned in that short amount of time is that it is so complex that I really believe we would be foolish to rush into a solution. I first want to thank the Hospital Association for providing suggestions on how we can reform. I think that's extremely helpful, and it shows a willingness to work on this problem with us, so I'm grateful to you for that. My question is a legal one, and so this might be appropriate for you, Mr. Guilfoyle. It seems to me that the way that this bill is drafted, it essentially is depriving the interested parties of due process. Do you think that the bill, if we passed it, would be subject to that sort of challenge? And if it was challenged, what would we expect in terms of an outcome?
I don't think there's any question that the bill presents constitutional problems, due process. I learned a long time ago not to come in front of a legislative committee and talk about the Constitution, because normally the response is, go to court with that one. We can't handle that. But you raise a good point, because there's a lot of talk about the competitor's veto, the dominant provider's veto. We're talking about people in the community, and it may be a nonprofit, advocacy group. They have a right to be heard under our Constitution at an appropriate time. They have the ability and the right to cross-examine. And I think that this bill, in my mind, unquestionably violates the Constitution.
Thank you for your answer. I feel confident in saying that probably most of the legislators who I've spoken to do have an appetite for reform.
Mm-hmm.
And I believe that the medical institutions also have an appetite for reform.
Mm-hmm.
I know that the task force can do more research, bring more experts, and we can come up with better solutions than what's been proposed here. I'm a no on this bill, although I hope we'll continue to operate the task force in the coming interim, and I'll welcome your input on that. Thank you so much.
Thank you.
Thank you, Representative Burke. Representative Bentley.
Excuse my voice, it's the tree pollen time. Thank you, Ms. Chair Lady. I have a preface, and then I have two questions. My preface is, I am from rural Kentucky. I'm not a lawyer. I've been a pharmacist for 50 years and stood behind a counter and treated people to try to make them better. And that's all I know. In my area of the country, that 80% or 81% is true. I see it every day. I've had farmers come in burnt from their fingers to their head, not knowing where emergency room was because we just closed the hospital. So I put them in my car and take them to the next hospital. So to fight over this is foolish. We got to worry about the patients, okay? And I have been a chair of a task force. And I was a board member of a hospital for 9 years. So that's my preface. Now my question is for the AFP person. I have two questions.
Okay.
I'll tell you when I'm done with the first question. How many years have you worked in hospital administration and finance? Can you explain the difference in regulation of a hospital versus an ambulatory surgical center? Are the ambulatory surgical centers subject to the Federal Emergency Treatment and Labor Act like hospitals are? That act requires hospitals to treat anyone who come into the ER regardless of their ability to pay. That's the first question.
Did you want me to wait till the second question or go ahead and
No,
answer?
I want you to answer that one now.
Is your microphone on?
Yes, it is. So at AFP,
Let me go through it again.
Okay.
How many years have you worked in hospital administration and finance?
I worked in home health at one point, but that was the very beginning of my career. So not hospital administration, although that was my major.
Okay, can you explain the difference in this regulation of a hospital versus an ambulatory surgical center?
Not the regulation, no.
Okay, let's go on to the second question. I want to articulate it right so my wife doesn't holler at me when I get home. For the sake of argument, let's assume that without certificate of need measure someone wants to build a new hospital. Say in Greenup County, Kentucky, where I'm from, where we closed one, and we closed one right across the river in Lawrence County, Ohio, when I was up there. Given the nationwide shortage of healthcare workers of all types, where will the staff come from to run the new hospital? Won't labor costs go up if the new facility is bidding for the same workers that already exist? Who will pay the higher costs? There is a healthcare labor shortage in Kentucky of more than 13,000 workers. End of second question.
I mean, I think that same problem is occurring across the country, so it's not unique to Kentucky. Let me just answer both of your questions in this way. AFP represents thousands of Kentuckians. That's my role as state director, is to represent thousands of Kentuckians. And we talk to those Kentuckians at the doors every single day about this issue and other issues that concern them. And healthcare is a huge concern for Kentuckians. Access to it, the cost of it, those are both huge concerns for Kentuckians. And we talk to them every single day about it. And we know from working on this, AFP working on this for the past 10 years, that this is an effective strategy to improve the access and the cost of healthcare. We've seen it in state after state. And so there are complex issues around this, and I agree with that. And I think that having these discussions are very important. But my role is not as a healthcare professional. My role is here representing just everyday Kentuckians.
That's my job too. 2 days ago, we cut the ribbon on reopening Bellefonte Hospital into a psychiatric hospital. It took me 3 years of hard labor, and everybody on this committee knows that. I sponsored the rural hospital bill. We thought there'd only be 2 or 3, but now there's 8 or 9 on that. We know how fragile the rural hospitals are in Kentucky. So thank you for your time, lady, and thank you, Chair Lady, for your time.
Thank you.
Thank you. Representative Justice.
Thank you, Chair Lady. I want to ask a few questions and then speak on the bill. And I'll be speaking to you guys. Yeah. So one thing I learned in Frankfurt is sometimes you'll read bills and you'll think, oh, this is pretty easy. It's no big deal. And then you get a veteran that will tell you there's something hidden in it. It's a little fishy. And that's kind of what I think this is. Even though it doesn't explicitly say it, this would effectively repeal the certificate of need, correct?
Yes, sir.
Okay. And though they say it doesn't affect reimbursement, but if you allow other entities to encroach into an area, the standing hospitals will get less reimbursements. So effectively it does affect reimbursements, correct?
It's not necessarily going to affect the reimbursement rate. But
yeah, not the rate.
It will affect the bottom line, no question about that.
Yeah, the patients coming in that you're collecting reimbursements from, I would say.
Yeah, and I would say, let me just pick up on Representative Bray, almost made you a doctor. You know, in terms of rural health care, right, what you're going to see is this cherry picking, and it can happen in urban areas. It's already happening in northern Kentucky. But if Representative Bentley talked about an ambulatory surgery center, if a for-profit provider wanted to locate one of those in a rural area, that facility is not subject to MTALA, which is the federal law he referenced that requires you to serve anybody who shows up at your doorstep. So the hospital's going to have to serve anybody, but the ASC, the ambulatory surgery center, would not have to do that. So, long-winded way of answering your question, the hospital in that instance obviously is going to be hurt because the private pay and the people who can pay the bill are going to go to the ASC and not to the hospital.
Yes, and that's kind of, I use that, it's an anecdotal example, but if you open, say, a birthing center or any kind of center across the street from the front door, and before there was 100 patients all going into the rural hospital, now there's 10, and 90 of them are going to the other entity. And a lot of times that 10% is the most complicated cases, and the other entity gets to cherry pick the easiest and the more of the patients.
That's exactly right, and yeah, I think I would completely agree with that.
Would you say that it's true that approximately 10 or 11 hospitals are vulnerable to closure?
Well, when we testified on August 21 in 2023, we cited a study that says in Kentucky, if CON is repealed, 11 rural hospitals are at risk of closure. That study has not been updated since then, but that's what it was back in August. And when we see in other states, Ohio, for example,
Indiana.
when CON is repealed, rural hospitals close, period, end of story. So that's just a fact.
Lots of these hospitals are the sole providers for those communities. In my district, there's one show in town, and if it's hurt, then my constituents don't have anywhere to go. Let's see. Would you say that this bill would be kind of disproportionately beneficial to northern Kentucky and not so much rural, eastern, and western Kentucky?
No, I don't see this particular issue, and I think hopefully we made that clear with the task force. This is not a northern Kentucky issue. It's statewide.
Yeah.
And it's really not rural-urban like a lot of issues are down here. Mr. Lloyd has talked about the impact on rural hospitals, and I think people on this committee have real live experience with that. So it's a statewide issue. When we look at the regulation of health services, that needs to be done on a statewide basis. So Representative Burke, as we go about the business of trying to modernize the state health plan and modernize CON, we're looking at that on a statewide basis. So in northern Kentucky, there's talk about a dominant provider is my client, St. Elizabeth Healthcare. We are the hospital in northern Kentucky, but we operate in a greater Cincinnati healthcare market. So we had a Cincinnati hospital wanted to come to northern Kentucky to open up an ASC, an ambulatory surgery center. Wouldn't take any Medicaid, very, very little Medicaid, Medicare. Private pay, take the patients back to Cincinnati, to the mothership, while St. Elizabeth, which is the safety net provider, would be left to care for Medicaid, Medicare, and no pay at all. That's disproportionate to your question. So in the rural Kentucky, the hospitals have to take care of everybody. In many instances, they're the only game in town. So to allow someone to come in without an evaluation of what the impact will be on that hospital is, as Don Lloyd said, unacceptable, really unacceptable.
And my constituents, I represent Pike, Letcher, and Harlan. So if they have to go somewhere else, if they have to go to Lexington or Louisville, it's 3-4 hour drive. So, it's just unattainable. I just want to speak a little bit about this. Kentucky's ranked 5th lowest health or life expectancy, 3 years lower than the non-CON states. We're 9th for the highest rate of Medicaid patients. So it would heavily affect my area. I've been speaking with the Kentucky Hospital Association and ARH, which is in my district, as well as PMC, Pikeville Medical Center. Even though it's technically not in my district, a lot of my constituents still go there. And they're struggling as is. So anything that would negatively impact, the healthcare system in my area, I can't be for it. As Representative Bray said, it would be nice if there was a free market that existed in healthcare, but it just simply doesn't happen. So I have the largest district in the entire state, geographically. So we all represent roughly 45,000 people. My district, it's like a 3.5 hour drive. So all those people, they're sparsely populated, and we need these rural hospitals. We got to encourage them to survive and help them, you know. So I will be a no on this bill today, and I just wanted to explain that. Thank you.
Thank you. I have a question along, kind of following the same train of thought. The charity hospitals or the rural hospitals who are primarily Medicaid population, what is the reimbursement rate? What is the Medicaid reimbursement rate in average? I know that it varies on some services.
Madam Chair, prior to the legislative's action to support all hospitals in Kentucky through the Hospital Rate Improvement Program, our institution received about 55 cents on the dollar of cost, not reimbursement, but on cost. And so every Medicaid patient that entered our doors, we actually had to subsidize their care from another source. Thanks to the legislature and your support of the needs of the Commonwealth, we are near a break even in some cases on certain services. Others we still lose substantial money on. But that number used to be 55 cents. I will tell you it is north of 90% on some services, and then there's other services that where that gap is still not filled. And that's the case. I can speak specifically to St. Clair Healthcare in that regard.
Okay, thank you. And so these are subsidies that are coming from the taxpayers. But if we were to allow some of the private insurance and fee-for-service to be siphoned off by eliminating CON, what would that look like?
So for my institution specifically, we currently subsidize a multitude of services that aren't available in the region. One in particular is obstetrics and gynecology. You must travel almost 60 miles to get to the next provider to receive obstetrics and gynecology services from a gynecologist. Another is in our community, we are the only dental provider providing dental clinics to serve the Medicaid population, and we subsidize that in excess of $500,000 a year. Now, there are tremendous comorbid conditions that develop as a result of poor oral care that we're seeing in our emergency rooms as a result of lack of access to dental care. But those services are subsidized by whatever margin we can generate. Even with the Hospital Rate Improvement Program, my current operating margin is slightly above 2%. And that is not enough to reinvest in services or technologies or resources or in this inflationary market to counteract the needs of the patients, not of St. Clair Healthcare, but the needs of the people we're called to serve. And I could say that in my colleagues across the entire Commonwealth, whether they're in rural areas or urban areas. You look at the work that some of the health systems are doing in Jefferson County to fill the gaps. You look at the work that's being done in northern Kentucky that's being applied to fill the gaps, especially for individuals in active recovery and addiction. And those services could not be provided to meet the needs of the people of the Commonwealth without an ability to at least produce a sufficient margin. But I will go back to my opening comments, Madam Chair. This isn't about margin. It's about people. It's as Representative Bentley said, it's about providing high quality care to people that are marginalized and disenfranchised and have great barriers to accessing that care.
Okay,
Thank you.
We have a couple more questions. Representative Raymer.
Thank you, Madam Chair. Mine is for the bill sponsor.
Thank you, Representative. I know you've worked hard on this subject. I know you and I have had conversations about it. The first is a technical question. So on page 3, it says, conduct public hearings as requested by applicants for or holders of certificate of need or licenses. And the rest of the bill, it just says applicant. So the goal is, once a CON has been granted, that there's no recourse for any affected party to appeal. Is that correct?
What happens with this bill is that it levels the playing field. It allows somebody, I think what's being lost here is assuming the cabinet is going to automatically give a certificate of need. What a new applicant still must meet the state formula. They still must show the need. They still must go through that 9-step process to obtain the certificate of need. So I'm not sure where this automatic approval is. They still have to go through those. What we found, and Mr. Guilfoyle has even said, that if a new entity wants to come into Northern Kentucky, they will sue. What we are trying to do is to allow an entity that is ready, willing, and able to make the economic investment into Kentucky to be able to do so on a fair playing field, the same as somebody who already holds the certificate of need. So yes, it does allow them to hold the meetings, and it does just prevents the dominant provider from suing them along the way, which did happen in Northern Kentucky when another institution did obtain the certificate of need, but our circuit court determined that they didn't deserve it when they had already gone through that process. So it's just to make it level.
Okay, so just to follow up, I've learned that just recently in a market that I worked in, this process was used for someone to appeal a certificate of need that was granted. And the person that appealed it, the facility that appealed it, the burden was on them to prove that the CON had been granted, but that the facts that were presented were not accurate. So and the appeal worked, and that CON was stopped. And knowing that market and the facilities involved, I believe it was the correct thing to have done. And if this bill had been in place, they would not have been able to stop that. And, you know, I'm a free market type of person, but unfortunately, working in a hospital for nearly 20 years, I know that healthcare is not a free market. You know, the facility that I worked, around 60% of the reimbursement came from government payers. You know, it's a highly regulated market. And my fear is if a facility comes into a market where the numbers truly can't support those type of payers being split up, the care of our patient populations will suffer. That is my biggest fear. And I like that the task force met on that. I hope the task force continues. I think it's worrisome to me that the task force came out with the recommendations of let's not do anything right now. Let's continue to look at this and really try to figure out what is the best way to go about this. And I just think that this may be a jump too quick, and that the task force needs to continue, and we really need to analyze this situation. Thank you.
Thank you. Representative Rayburn.
Thank you. I've got a couple comments on the bill and then a question for the bill sponsor, Chairman, if that's okay. You know, a lot of my colleagues have made points today, and I'm kind of sitting on the other side of this as far as what this would do for rural areas and the great benefits that it could bring to areas that I directly represent. Lower cost, better quality health care, and more access to the health care needs that they desire in the 47th district. So my question for the bill sponsor is, how will this be beneficial for rural areas? And I know you've touched on this a little bit, but go into a little bit more detail on that. Thank you.
Thanks for that question. So, you know, like I said earlier, the evidence shows us that despite our concerns about what might happen in rural areas, that there are more rural hospitals per capita and more rural surgery centers per capita in states that have already repealed certificate of need laws. There are more of other types of facilities and services as well. So we can look at actual data and see what's happened and know that it isn't true that surgery centers opened in rural areas and then the rural hospitals closed. There couldn't be more rural hospitals per capita if that were true. There's more hospitals and more surgery centers, so the competition is making everyone do better. One problem with this argument about cherry picking is that it assumes that the correct number of patients are already getting care, when in fact we know there are lots of people going without care because they don't have access for a number of different reasons. The facilities might not be there, they might not be able to afford it. Even people with private insurance often delay or avoid necessary medical treatment because they can't afford their deductibles or their coinsurance. So as you mentioned, doing something to help affordability as well will also increase access. And I wanted to share some data. I can provide this to the committee, but the University of North Carolina has been tracking rural hospital closures since 2005. And Ohio repealed its Certificate of Need program for everything except nursing homes in 2012. Since that time, it has only had one rural hospital closure. But in that same amount of time, Kentucky has had 3 rural hospital closures. And that's with Certificate of Need laws in place. So these laws aren't preventing hospital closures, and the neighboring states are doing better on that.
Okay, thank you. Representative Justice, you have a comment?
Yeah, I just wanted to say I don't speak for all Eastern Kentucky, but I do speak for the 94th District. And when I got here, my constituents had 2 major issues. One was astronomical power bills, and then number 2 was the ambulance EMT response time. So it's like 1 to 3 hours in my area. So if you have a cardiac event, you have a 90-minute window before it really goes bad. And oftentimes people are waiting around for like 3 hours. And that field or that subject, I think repealing CON would be beneficial. But when it comes to the hospitals, I think repealing it would be harmful. So I just make my decisions based on what would help Appalachian patients, what would support health care, and what would protect them from any further harm. We're one of the poorest populations, and we feel forgotten. We don't want to lose our hospitals, and we don't want to lose our health care. Thank you.
Thank you. And I would like to just kind of weigh in on House Bill 777. That was an instance where we were able to repeal CON for ambulance service or really streamline that system. So I think because we have so many health systems that are regulated under CON, we have great opportunity to really look at those systems independently, individually, and find efficiencies and streamline the process. I've had great conversations with my friends at Americans for Prosperity and Pacific Legal and the bill sponsor about this, and I have relayed my concerns about the limitations on due process and the potential constitutional issues. And so I think that there's still a great need for the task force to continue. I know that was the recommendation of the task force, which I believe, I think, well, I know you're a member as well, that was the consensus of the task force, and that we weren't quite ready to really take action, that this needs to be a comprehensive look at this very complex system. I don't want to get ahead of the task force, but I definitely think that there's room for finding efficiencies and streamlining this process. I think we'll get there. I just don't want to do it prematurely. I appreciate all the conversation today. I wanted to give you an opportunity to come and talk about this and just see what the will of the committee is as far as moving forward. So I don't see any further questions. So I guess we have a motion and a second on the bill. DJ, go ahead and take the roll.
Representative Bentley.
One sentence. It's premature to pass this legislation until further study recommended by the task force is being completed. No.
Representative Bratcher.
Explain my vote, please.
Yes.
So I own a healthcare facility, and I had to go through the grueling process of getting a CON. As much as I didn't appreciate having to go through it, I recognized that I had some neighbors that had concerns about me putting a facility next to their neighborhood. And they came and we worked it out. But in this in this specific wording that basically prevents or silences people from being able to talk about CON or a facility going in place, it concerns me that we're violating some core things in the Constitution, which is due process and the right to public hearings. And can you imagine here, if we didn't have public hearings now, what would happen? And I think that's in this what we have here is we're kind of silencing some people from not being able to speak on it. Do I think certificate of need needs to be repealed? Absolutely. I think there's some major problems with it, and I'll be the first one to stand there and help you with it, and I'll even volunteer for the task force. But in this situation, I just don't think that this is the time. We need to see what the task force comes up with, and I want to make sure that we're doing something that's sustainable and strategic. And if we can't, in this situation, I just don't think that we're I agree with Bentley. I think we're being too premature. So I'm going to vote no today on this.
Representative Bray.
Explain my vote, please. I'm going to be a no. I agree that I think it's a little premature. You know, the task force came back with a recommendation to study it some more. Same thing my jail task force did. I've not filed a bill on it on jails because we're just not there. But in this case, I do have grave concerns for rural Kentucky. I've not had a single conversation. I've not seen the data you're talking about how this will improve health outcomes. I've had one email on CON and no other conversations, no meeting request. So I'm a no.
Representative Burke.
I'd like to explain my no vote.
Yes, go ahead.
I think every person in this room agrees that Kentucky's health outcomes are troubling, and we need to solve that problem. I'm not convinced that this bill does it, and I hope that we will continue working through the task force to find solutions and changes we can make to the Certificate of Need program so that we can improve those health outcomes. Thank you.
Representative Callaway.
I'd like to explain my vote.
Yes.
You can put me down for a yes. And I want to explain that I do have Bullitt County, a portion of Bullitt County, and we did just open up a hospital, which I'm extremely grateful for, and I would never do anything to harm that. But I'm also hearing from an adult care center that has been in direct competition, is seen as direct competition from another entity. The mayor's even reached out. We need this other daycare, this adult center. And because the competitor has been so intrusive in this process, it hasn't been able to happen. So when we use the word interested parties, I don't see individuals, I see competitors in this instance. So when we're talking about due process, we're allowing a competitor to come in and directly attack a competitor. So I just don't feel like that's comparing apples to apples. And I do feel like if the board is so incompetent, if the cabinet is so incompetent to be able to tell truth from lies and to be able to do this right, then we need to address the board or cabinet and not go and not give the competitors more power. So that's my 2 cents worth and my reason for the vote. Thank you.
Representative Camuel.
Thank you for bringing the bill, and I actually agree with my colleague. Certificate of Need needs to be examined, but I don't think we're ready yet. And I'd like to echo my thanks as well to other members who voiced concerns. I am a girl from rural Kentucky, living in the big city now, but I know that I worry that this will do damage to hospitals, so I'm a no. Thank you.
Representative Dotson.
Explain my vote, please. I think it would be unwise to say that one size fits all. It does not, especially when it comes to CON. And I'm for reform. I'm for free markets, but I'm also an Eastern Kentucky boy. I want to protect the regional facilities as well as the rural facilities. But I'm going to be a yes vote today because we can't keep kicking the can down the road, trying to, we'll come back next year. I think we need to address it. My thing is this: I don't see why this can't be worked out and do carve-outs, density of population carve-outs. And that's why I'm voting, because I think the sponsor would be open to that, because I think she sees the need to that. So with that being said, I am a yes today, reserving my right to change my vote if we don't get those type of carve-outs. Thank you.
Representative Duval. Representative Fraser Gordon.
Explain my vote.
Yes, ma'am.
Okay. I do appreciate the spirit of this bill. I really do. And I think we all can agree, everyone in this room, that we need to work on access and affordability for health. It's something that I've been working on in some of the bills that I have passed. I do have reservation about the affected persons aspect of it and also the appeals process. But you know, this has been a really interesting conversation, and I've learned more on the matter. And I think looking at it through carve-outs might be a good way to go. But I think one size fits all is not the way that we should go with this bill in its current form. So I'm a no today, but I look forward to seeing what happens in the future around this issue.
Representative Justice.
Explain my vote. The hospitals and the Kentucky Hospital Association, they're okay with modernizing the CON and tweaking it. Just you can't shut down opposition to the applicants and effectively repeal it. So I identify as a feral hillbilly dentist from Pike County, and I got to protect my hospital, so I'll be a no.
Representative Neighbors.
Explain my vote, please.
Yes, ma'am.
You know, it's not only my desire to protect rural hospitals and live in rural communities to have access to health care, but considering my background is in long-term care, it's also my desire to protect that industry, and repealing CON would be detrimental to our nursing homes. So for that reason, I will be a no today.
Representative Rayburn.
Yes.
Representative Raymer.
Explain my vote.
Yes, ma'am.
You know, I live 45 minutes away from the nearest hospital. I live in rural Kentucky. And the fear that I have of what this would do to the rural hospitals that are in my area, it makes me a no today. I have concerns about the affected parties and the due process for them. I hope that we will continue these conversations. I hope the task force continues, and I'm willing to engage and have those conversations to look at where we can make changes. But I'm a no today.
Representative Riley.
Explain my vote. Oftentimes when people apply for jobs, I tell them there's three answers: yes, no, and not yet. This is a not yet, so that's a no.
Thank you.
Representative Rourks.
I'd just like to briefly explain my vote.
Yes, ma'am.
I'm a no today. I do support reforming CON, and I appreciate the opportunity to have this discussion today and all the learning that has been able to be granted due to having this conversation.
Representative Sharp.
Explain my vote, please.
Yes.
I think this is a very complex issue, and I'm going to default to the task force where they need to study it more. So I'm neither for nor against, so I guess I'm passing on this today.
Representative Wilner.
Explain my vote.
Yes.
I'm going to be a no today. Like others on the committee, I recognize the need for CON reform. It's really needed. I was really happy to be part of the EMT task force a couple years ago, where we came up with the recommendations that led to House Bill 777, and I was very glad to vote yes for that. And I think that's a better process where we can really have deep study, come back with the recommendations. And I also want to say how much I really appreciate the robust discussion we had today. I really learned a lot from both sides on this issue. And finally, I'm never going to be able to support where we're removing the voice of individuals, particularly those with disabilities, when it affects their own health care. So I really am very grateful for that testimony. So with that, I thank you for the bill, but I'm a no today.
Representative Whitten.
Explain my vote.
Yes.
As Representative Sharp said, I'm a pass. I do agree that there's a yes, no, and a not yet. And this conversation today has been illuminating, and it has brought forth a lot of new conversations that I look forward to having. I was on the task force this summer. I think that this is necessary, and I think that there's a ton of good in this bill, but it needs to be worked through a little bit more, and I'm convinced that we can get there.
Chair Mosier.
explain my vote. I do appreciate your efforts on this and the conversation that we're having. The task force, I think, is going to be invaluable in finding those efficiencies and streamlining the process that we know that we need. We are working on other provisions to increase access to care, and so this is not. This is only one piece of the puzzle. This is such a complex issue, though. I really have reservations about piecemealing this in legislation that hasn't really been fully vetted by the task force yet. And so I'm going to be a no today, but I do want to help work on this moving forward. So thank you very much for being here. Thanks, everyone, for the great discussion. So House Bill 204 fails with, we have 3 yes votes, 13 no votes, and 2 passes. So again, thank you for being here. I wanted to make sure that you had an opportunity to discuss this.
Well, thank you, Madam Chair. I appreciate it and look forward to ongoing conversations.
Absolutely. Thank you. Okay, having no further business to come before this committee, there is the possibility that we will have a special meeting for other Senate bills that are coming across. I do want to, in case we don't have a special meeting, thank all of our staff, all of this session for your work. They are extraordinary, and we are adjourned. Thank you.
Everybody, how much money does your company get from this? There you go, my money. Well, I represent them.
They represent me. Okay. Yeah, sorry.